The U.S. coronavirus death toll has now topped 400,000, just one day before a new administration is set to take office. 100,000 of those deaths were recorded in just over a month. Health experts warn we could hit 500,000 deaths sometime in February. So far, more than 24 million cases have been confirmed since the pandemic began. The incoming CDC director warns we have yet to see the impacts of holiday travel, and coronavirus mutations are emerging across the country. But there could be some good news about the vaccine. David Begnaud reports from Michigan.
Tonight, the race to vaccinate remains urgent as new COVID variants are being detected. The UK variant is now showing up in at least 20 states, which appears to be 50% more contagious. Are the vaccines going to work against the new mutations of the virus?
At this point, we have a concern that the vaccines may be challenged, meaning that they may have reduced the capability of preventing disease.
Which makes vaccinating now even more critical. And the nation's most populous city has a critical problem with their vaccine supply.
At the rate we are going, we will begin to run out on Thursday. We will have literally nothing left to give as of Friday.
But in Michigan, where we are tonight, there is a scramble to get the vaccine to underserved rural communities. So twice a week, Dr. Richard Bates loads a cooler filled with the Pfizer vaccine and drives 2.5 hours to a small town hospital.
It was important for us that every community felt connected and felt that they weren't left out.
Across Michigan, the vaccine rollout is in full swing.
All done.
Here in Lansing, they're giving injections inside of what used to be a Sears service center. You used to be able to get your oil changed here. Now you can get an injection. They got the cars lined up outside the doors, people waiting in the snow. Tonight, a moment of reflection for the 400,000 people lost forever to this pandemic, including Betty Gallagher, or Mrs. Betty, as she was affectionately called, by those at Alabama's Coosa Valley Medical Center. She died last week with COVID inside the same hospital where she worked as an ER nurse for 43 years.
Infectious disease specialist Dr. Uzma Syed joins me now. Dr. Syed, thanks very much for being with us. The coronavirus has now killed more than 400,000 people in the U.S., but the incoming CDC director says there are still dark weeks ahead. Doctor, what can we expect?
Absolutely. You know, we are going through our darkest times in our nation, and people need to really be aware of that and not let their guard down. We've seen significant rise in cases with the holidays and with the travel, and we're going to continue to see this, especially as people are gathering indoors more. And now that we have, a good amount of evidence that there is significant community transmission with the new variants, people really need to do anything that they can to really try to limit the spread of this virus, because the models are predicting that we can see an additional 100,000 more deaths in a very short amount of time, even within a month.
Well, a new administration is about to take over. How confident are you in President-elect Biden's plan to fight this virus? And Doctor, what role do you think that the federal government needs to play moving forward?
I think, this is a glimmer of hope, in these very dark times. What the country has really needed has been a national plan. Unfortunately, everything has been left up to individual states, and we can see that, the country is really in terrible shape right now with respect to the pandemic. So a national strategy and really having good plan in place for all aspects of pandemic response is really, necessary at this point, especially when it comes to vaccination. So really getting adequate vaccinations under production, getting vaccines allocated and administered, having, a lot more vaccination sites readily available so we can reach the masses to really ramp up vaccinations and really increase testing so that we can start to protect people throughout the country and really start saving lives and really put a halt and, a decline in this sharp incline that we're seeing across the country.
Well, the U.S. is still behind in vaccinations. What are some of the biggest obstacles that hospitals are facing in administering these vaccines?
I think the issue that we see is, multifold. It trickles down from various levels, as I mentioned before, not having adequate plan on a national level and sort of restricting it all on the state level and expecting hospitals to really have this rampant vaccinations going out to the public. First, there are many problems that are arising with supply and demand issues, inadequate vaccination sites, inadequate staff, not reaching people that may not have access to hospitals, people that are now qualified that cannot find vaccination centers, cannot find appointments. So there really is an urgency in the matter, and we really need to ramp this up. Include multiple pharmacies, multiple vaccination sites. Whether they be stadiums. Really get the staff, get the people there to really get the vaccines rolled out as quickly as we possibly can.
And Doctor, we know from polling and from reports that some healthcare workers are refusing to get vaccinated. Why do you think that is, and is that something you're concerned about?
It is a valid concern. We're seeing this across the country as well. And, there was so much effort that was put into the production of these vaccines. And there was really scientific, breakthrough with these vaccine developments and production. Unfortunately, there wasn't that much emphasis put into really preparing the public and educating the public on these vaccines. So whenever you have something that's new, there's always hesitation. And unfortunately, there's a lot of misinformation that has been spread out there. Healthcare workers are people too, so they may be believing some of the misinformation that is out there. And so it's really up to us to continue to put the same amount of focus on educating the public, including healthcare workers, so that we can really start to vaccinate more and more people.
Such an important point. Dr. Uzma Syed, Doctor, thank you so much.